All right. Good morning, everybody. So welcome to our topic today. We're going to be talking about the biosocial theory of borderline personality disorder. Now, this topic, I'm going to talk a little bit about the limitations of that diagnosis, but the biosocial theory actually applies to a lot of different mental health conditions. And so even though we're going to talk about BPD today, it can apply to a bunch of different things. And understanding this theory is actually something that we cover in DBT, because in DBT, we talk a lot about recognizing causation, right? So why am I struggling with this? Or why do I experience these sorts of things? And so the biosocial theory just helps us to maybe fill in some of those gaps in our knowledge about, why we're experiencing what we're experiencing. Okay, so let me get my slides. All right, go into present mode. There we go. All right. So the biosocial theory, in a nutshell, suggests that, so in this case, borderline personality disorder is a result of both genetic and environmental factors, including what we call invalidating childhood environments or experiences. So basically, the biosocial theory is that there's biological elements and there's social environmental elements. And it's the interaction between those that create something like BPD. Again, this applies to a bunch of different mental health conditions as well. So things like anxiety disorders, depression, we have biosocial theory around those as well. So that it's not just biology and it's not just environment, it's actually how the two interact. So since we're going to just focus on borderline personality disorder today, in a nutshell, BPD is a disorder of emotion dysregulation. Okay, so that just means that the main symptoms of BPD are difficulties regulating emotions, and that emotion dysregulation is a result of what we call emotional vulnerability, as well as sometimes just not having enough skills to regulate emotions, okay? But emotional vulnerability is this biological factor that we think some people can be born with, right? So that emotional vulnerability, I'll just answer this. Yeah. Sorry, Ruby, that was a no to what? Let me know in the chat. Oh, right, to Zoe. Okay, no worries. So emotional vulnerability, is that biological factor that we can be born with. So we're going to explore that. So what is emotional vulnerability? What do we mean by this? There are other terms for this. It could be emotional sensitivity. I know that's a term that I hear a lot of people use, feeling like they're just more emotionally sensitive than other people, or they feel emotions more strongly than other people. And we do know that some people are born feeling things more strongly than others. So emotional vulnerability is not a lack of self-control, okay? It's not a matter of choice. It is something that we are born with. And if we think about emotion vulnerability on a bit of a spectrum, right? Some people might be very sensitive to emotions and feel things very strongly up this end, all the way down to people that don't feel things hardly at all. And both of those extremes obviously can be difficult. And then we've got everything on that continuum here, where we might sit, where maybe I'm not in this extreme, but I'm down this end a little bit, right? So there's a whole spectrum where we could sit. but it's not a matter of choice. We think that it's inborn. And that's because there's a bunch of studies that show that newborn babies have, a huge variety of different levels of emotional response to stimulus. So they've done a bunch of studies where, they do things like tickle babies with feathers and, different things like that to show, what their level of reactivity is. There's a broad spectrum. There are some babies where they barely register it, and there are some babies where it's very distressing and uncomfortable for them, and then everything in between. So we do think that we are born feeling a lot or a little or somewhere in between. And so then we say it can be biologically determined. It's not always, but it can be biologically determined. We don't know why it might be biologically determined for some people. There might be genetic links. We're not really sure. I'm going to talk later on about some of the limitations to studies in this area and why there's still heaps that we don't really know for sure. Here comes Christine. But, from the studies we do have, we think, yes, that we are born with a certain level of emotional sensitivity. So there are three main aspects to emotional vulnerability or emotional sensitivity, okay? So I'm going to run through these main three areas: sensitivity, reactivity, and what we call a slow return to baseline, okay? So the first one, emotional sensitivity. So this is, if somebody is emotionally sensitive, it means they might have a lower threshold for emotional reactions. So again, in those studies with babies, the babies that become quite upset with, a physical stimulus, we would say they might be more emotionally sensitive than other babies that don't. What may be bothersome to most, what may not be bothersome to most is bothersome to an emotionally sensitive person. So, and again, there's a bunch of different reasons why that might be the case, but some people say, things bother me more than they seem to bother other people. That can be a bit of a sign. Maybe reacting to slight frustration or annoyance. So again, what might not bother some people triggers a lot of frustration and annoyance in someone who's more emotionally sensitive. And people that are more emotionally sensitive have the ability to detect subtle emotional information in the environment that others don't notice. Okay, so it's thought that most therapists have high levels of emotional sensitivity. We're probably born with some of that, and then we also kind of hone those skills. But also, thinking about, are you a person that picks up emotional information when other people might be totally oblivious to it? Right? So often people that are emotionally sensitive are very tuned into body language and nonverbal cues. Pros and cons to that, right? Because sometimes we get it right and sometimes we don't. And experiencing emotions much more frequently than others, and sometimes for seemingly no reason or out of the blue. Now, we know in DBT, we always say there's always a reason for a trigger, right? Emotions don't happen for no reason, but they can be sometimes a little tricky to figure out. But people who are emotionally sensitive feel like, they experience emotions much more often, and that those triggers can be quite sneaky and hidden and confusing. Again, like nothing's happened. Why am I feeling so bad today? Right? So those are some signs of emotional sensitivity. Then we've got emotional reactivity. So it's the second part of, emotional vulnerability. So this refers to the intensity of emotions and reactions. Again, what may be disappointing or annoying for many may cause an emotionally reactive person to feel overwhelming sadness and rage. So, other people might still have a reaction, but for the emotionally reactive person, the reaction is much more intense. On the flip side, it also means that they may experience joy more easily and fall in love faster. We've talked at other times about, intense attachment and favorite people and those sorts of concepts. And so if I'm somebody who, experiences emotions much more intensely, then when I fall in love, fast and hard, right? When things are great, they're really great. This can also be why sometimes BPD is mistaken for bipolar affective disorder, because you can see those intense ups and downs. And then thirdly, we've got this slow return to baseline, okay? So what that means is that reactions to emotional stimuli are long lasting, okay, longer than, say, the average person. What that means is that once somebody is upset or feels dysregulated, it takes them longer to return to a stable base. Okay, so if we think about our distress curve in DBT, right, maybe a distress curve goes like this. But for somebody who, has a slow return to baseline, they might go up and they may stay, quite overwhelmed for a lot longer before they come back down. People who have this slow return to baseline are more vulnerable and susceptible to other emotionally laden events, feeling like they hardly get a break, right? So if I get triggered and I'm up here and then something else happens, then it just kind of keeps my distress going, right? Because I haven't been able to come back down as quickly. Whereas if I'm, able to come up and down pretty fast, what that means is that I can kind of be ready for the next trigger. Yeah. What's important here to recognize is that these are not just like thoughts or feelings. This is actually a full body experience, right? So the whole body is in that kind of fight, flight, freeze mode for much longer. We know that those who have experienced invalidation or trauma tend to have higher baselines, okay? Or people that just feel like they're more emotionally reactive. What that means is that the standard, so where I might be, okay, here's my normal baseline of where I'm getting through the day. Somebody else might be here where, if this is breaking point where I start to get, like really bad panic attacks or start to kind of, not cope, rather than being here, I'm here, right? And so it doesn't take much to get there. So some people tend to live up here more, which obviously makes it much more likely they're going to get to overwhelm. So that higher baseline can be difficult to sustain long-term, very stressful, and can lead to self-harm and suicidal behaviors, again, because it feels like it's, sometimes it's constant crisis without much of a break, and that gets really exhausting. Okay. So those are all the things that kind of contribute to what we call, emotional reactivity or emotion dysregulation. Okay. These are all things, again, that we think have biological basis. We can be born with them. Now, talking just a little more about brains, right? We do know that in some studies of people with BPD, they found structural changes within the limbic system. So the limbic system is part of the primitive brain, if we talk about the advanced brain where all our good reasoning happens, and the primitive brain deals with big emotions and long-term memory and things like that. When they do scans of people with BPD, they can see physical differences in the primitive brain part, right, which may contribute to emotion dysregulation. Also, what they see is less activity in the frontal cortex, which is, emotion regulation and behavioral control, particularly when negative emotions are present. So what they do is that they get people to be part of a study who have a diagnosis of BPD, and they do what's called a functional MRI, where they can see where parts of the brain are lighting up as they look at certain stimulus. So they might show them pictures of things. And when they show them pictures of people that are upset or upsetting scenes or things like that, what they notice is less activity in that frontal lobe of people that have a BPD diagnosis than people without. What that just really shows is that it's much harder for people with BPD to regulate strong emotional states. Also, what they found is that people with BPD can tend to misclassify or misinterpret neutral faces and see them as negative. Okay, so this is something that is really important in my role to understand as well, that sometimes when I'm working with people, if I maintain a neutral kind of appearance and stance, a lot of people will interpret that as negative, right? Even though I'm not like pulling a face or saying anything negative, there are people that will interpret neutral as negative. And so when we work with BPD, we talk about needing to be much more validating and really show that validation more than we might do in other types of therapy, right? And so, yeah, there seems to be a difference there. Now, again, we're not sure whether that is something that we're born with or something that happens through experiences and trauma. But it does seem that people with BPD view a neutral expression as negative a lot of the time. And so this plays out in interpersonal reactions and in relationships, right? Where somebody with BPD might, interpret somebody else's thoughts or feelings about them in a negative way. So we also know from the studies that people with BPD seem to have a lower resting parasympathetic tone, okay? So the parasympathetic nervous system is the part of the nervous system that deactivates and relaxes, right? It, reduces our heart rate, relaxes our muscles, relaxes our breathing, all that sort of stuff. So people with BPD tend to have their state of relaxation is not as relaxing as other people's, right? So even when they're feeling relaxed, they might still be here rather than down here. So a lot of trouble in that full relaxation. Again, is that born or is that caused? We're actually not totally sure. We think it might be a bit of both. And we know that people with BPD have to work harder to regulate their emotions from a biological perspective. So somebody with BPD, their brain is working in these ways that make it much harder to regulate emotions than somebody without BPD, okay? So again, brain differences like this may be biologically determined, or they may be a result of trauma or an invalidating environment. We need a lot more research in this area because it's not really clear. Again, we do think there are some, we can see in babies, some, different levels of emotional regulation, but we don't know whether the brain changes are due to environment or biology. I'm going to talk at the end about why there's some difficulty studying this from an ethical perspective, as well as just a gathering data perspective.
Sorry, Alex. Sorry, I was just wondering. So can that be seen on a scan?
Yeah. Yep,
Okay.
that's right. So they can see there's a couple of different types of scans, MRIs they can do. So a standard MRI, they look at the brain structure, the size of the brain and the size and the shape of different areas.
Yeah.
And what they see is different, reduced sizes and different shapes, sometimes in the limbic system, which is the primitive brain.
Okay.
And on functional MRIs, where they look at what parts of the brain are lighting up, they see more activation in the fight-flight center and less activation in the frontal lobe, which is emotion regulation skills.
Okay, so, interesting.
Yeah, so you can see it on scans. Now, this doesn't apply to everybody with BPD, but this is overwhelmingly the majority of people they've studied, right?
Yep.
Yeah, so you can see a person without BPD's brain and a person with BPD's brain, and they look different. They look different in the structure and they look different in how they function.
Yep.
What we don't know is whether that is biologically caused, whether we're born that way, or whether brains are actually affected by trauma. We know they are to a degree. We're just not sure how much.
Okay. Yep.
Can trauma, change the shape and size of a brain? It probably can, it's looking like. Definitely trauma change how parts of the brain work.
Sorry,
so Yes.
Just as you're saying that, I'm like feeling so validated, because sometimes I feel like I have an acquired brain injury from trauma, not from physical trauma, like from an impact, but like sometimes that's how I see myself. So it's so validating to hear that, I guess.
Yes.
If that makes like it's fully changed the way that I think and function, you know?
Yeah, it definitely has. And we know that brains are very flexible, right? So, sometimes people use the word neuroplasticity, right? We know that if somebody, say, has an injury to part of their brain, with time, their brain will kind of make accommodations and kind of workarounds, depending on that injury. And this is what we think happens with trauma as well. And there needs to be more research into this, but when you have a look at the brains of people that have struggled with trauma or experienced trauma, and you compare them to brains of people with BPD, they're identical. So most people with BPD have experienced trauma. Again, the studies are kind of haphazard, but for the numbers I could find, it's looking like at least 85%. But that's only defining trauma in a certain way as well. And I think we're broadening our understanding of trauma, because for a child's brain that is very plastic and very adaptable, right? It's still growing. Things can happen that change that growth. And so we think trauma is one of them. And that's not just what we categorize as, abuse. That can also be what we call an invalidating environment, which is the lack of validation and connection. Yeah. So I'm glad you're finding it validating. This is supposed to be validating, because we're saying this is not like you're not trying hard enough, or that, some people are just like, they're just, not good at regulating emotions. It's actually much harder for some people to regulate emotions through no fault of their own. It's just brains. So let's look now at the role of childhood experiences. We know these are significant, and not just childhood experiences, adult experiences as well. But we often focus on childhood because of that, what I was just saying about, brains are still growing and developing and are very, very plastic and changeable in childhood. So in childhood, it's often that analogy of like the brain is like a sponge, taking in everything. So in this biosocial theory, we say, okay, so there's a biological element that we might be born with, maybe more emotional sensitivity or, different things like that. And then we add in an invalidating environment of some kind. And it's the combination of these two that creates something like BPD. So an invalidating environment, it's quite a broad definition, but it can be one that doesn't seem to understand your emotions. Okay, may communicate that your emotions are wrong, weird, or bad. So we're going far beyond trauma here. Of course, trauma is invalidating, but we're going far beyond that to say, even though, typically like what people think of as abusive upbringings, you may not have experienced that, but you may say, yes, my emotions were always, shamed or ignored or disregarded. And that can maybe be a contributing factor. Ignoring emotional reactions as well, right? So we've got both ends of the scale. Ellie said societal beliefs about what actually constitutes trauma. Yes, that's right. So we know now through more studies that a lack of emotional validation and connection in childhood can, in some cases, be more harmful than physical abuse. Now, physical abuse is obviously very harmful to a child, but being ignored and emotionally invalidated can, in some cases, be more damaging, because for a child's brain to be ignored feels like death. because as children, we are completely dependent on caregivers to keep us alive. And if my caregiver is ignoring me or ignoring my emotional signs of what I need, that is very, very dangerous for my child brain. Why do children cry? Why do children have tantrums? Because they don't yet have the skills to say, I need this or I need that. And so, caregivers' role is to read those signs and to fill in the gaps until kids grow old enough to say what they need. But if you have a caregiver that can't read those signs, right, or doesn't for some reason, what your child brain learns is that, that's very, very dangerous, and it feels like potentially you could die. That's what it feels like in a child's brain. With physical abuse, as damaging as that is, it's not as traumatic as complete abandonment, we think. So it's interesting, and a lot of people experience both. A lot of people experience, some of the abusive stuff at times, and then also the ignoring and the invalidating at other times. We could also say that an environment that doesn't encourage appropriate emotional expression could be an invalidating environment. So an invalidating environment can be trying to suppress the expression of emotions, right? Saying like, don't feel that way, don't say that, don't do that, don't cry, don't do that, or, just flat out ignoring. Ellie said, yep, with physical abuse, it's easier to identify that person was wrong. Yes, but with emotional abuse, it's, natural to fill in the gaps. It changes the way you think about yourself as opposed to the way you think about the perpetrators. That's exactly right. That's exactly right. So it's shame, right? It's that internal message of there's something wrong with me. There's something bad about me. And then, yes, it is much harder to then change those self-beliefs later on. Because if my child brain, for example, has been taking on these beliefs from, day dot, and I'm not challenging them till maybe I'm like 20, that's 20 years of practice my brain has had around there's something wrong with me, there's something bad about me belief, right? That's 20 years of patterns that we're trying to undo. And they're very powerful messages. And so this is why healing from invalidation and trauma just takes a really long time. So children who grow up in invalidating environments learn they cannot trust themselves, that their interpretations of their behaviors, emotions, thoughts, and perspectives cannot be trusted. Because they're told constantly that their feelings are wrong and their reactions are wrong, and a child then goes, right, well, I can't trust what my body's telling me. I can't trust what my feelings are telling me. I can't trust what my thoughts are telling me, right? And it creates this very, very unstable sense of self. And again, shame. I need to look to other people to tell me how to feel and how to behave and what's okay. So we know that there's a couple of different types of invalidation as well that we might experience. Corrosive invalidation we've talked about before. These are things like being ignored, being misread, being misunderstood, being treated differently, even though we're not that different, say between siblings or things like that, or incorrectly assigning negative intent to behaviors. These are all types of, invalidation that we often wouldn't put into the trauma category, right? But they can be very, very damaging. That word corrosive suggests that, if we experience these repeatedly over time, particularly from caregivers that we rely on, this really has an impact on the developing brain. And then we have, traumatic invalidation, which is, any form of abuse, so verbal, physical, etc. And again, really changes a child's view of themselves and the world permanently. And again, some studies show that 85% of people with BPD have what we would classify as, abuse in their background. So, yeah, again, this is why the biosocial theory comes in, because we say, well, if most people with BPD have a history of trauma, and then we also include the invalidating environment definitions, right, which we might not put into traditional trauma, we can see how, you know, an invalidating environment can affect people. Now, that being said, childhood for most people can be invalidating at times, okay? However, for some people, that invalidation is much more persistent and broad-reaching, or much more serious. But also, if we look at that combination, if I am born, you know, more emotionally sensitive, and then I encounter an invalidating environment, that is going to be even more painful for me, right? If I was somebody who had low emotional sensitivity and I was born with that, an invalidating environment would still be painful, but not as painful, right? So that combination is really sort of like the perfect storm, right? I feel a lot, and then I encounter all these sources of pain, and you've kind of got that perfect storm. You know, we ultimately run into the question here of what's the difference between BPD and, say, complex PTSD. I would argue that they are actually one and the same. A lot of us in the field, you know, I'm the diagnosis of BPD, I think, is a tricky one. We don't have a blood test to say you have BPD, right? And again, given how prevalent trauma is, you know, I don't see how we can actually separate the two. The good news is the treatment, or the recommended treatment, is the same. So at least we got that. So what are the things that we know helps if we fall into this category, right? So DBT, which you've done and you're doing, is considered the gold standard treatment for borderline personality disorder and for emotion dysregulation in general. So whatever's causing it, right? Whether it be complex trauma, whether it be other things, where emotion dysregulation is the problem, DBT is considered the best treatment for that. And studies show that DBT can reduce reactivity in the amygdala and reduce emotional vulnerability to triggers. So again, when they scan people's brains before and after a course of DBT, what they see is less activation in the fight-flight center and more activation in that frontal lobe that regulates emotions. So we've got some good research to show that DBT can actually change some of those brain functions, because the brain is so plastic and adaptable, right? So that's great news. Does take work though, right? Which you guys know. And also, you know, with DBT, we really try and focus on providing that safe, validating environment as a contrast to invalidating environments. So as I'm sure you've all experienced, sometimes help seeking and accessing healthcare services sometimes is not the most validating experience. Sometimes it can be quite clinical. And so with DBT, we try and sort of push against that a little bit. And because we know that people that are coming for DBT have experienced a lot of invalidation already. So that's why, you know, therapeutic relationships are so important in DBT. We know that helps heal brains as well. So here are some problems to consider with all of this, okay? There is limited research into the origins of BPD. So we have some studies, which I've mentioned, you know, that show different things, but we need more, right? It's actually really difficult to study and understand biological risk factors, especially in young children and babies. There's a lot of ethical issues around studying babies, right? And it's also really hard to study a baby outside of environmental issues, because you can't just like put them in a box, right, and leave them there for 6 months. That's not fair. So it's really hard to separate those things. So there's still a lot more work needing to be done, but this is sort of where the research seems to be leading, that there are, you know, biological factors and environmental factors that interact together. And yes, we need a lot more research to understand the impact of trauma. Again, it's very hard to research trauma, because how do you say, okay, we scanned your brain before your trauma and then we scanned your brain after your trauma and we can compare. No, because we just don't go scanning everyone's brains before they have a trauma, right? That we don't know that's going to happen. So yeah, that's tricky as well. It's like, are these brain changes a result of trauma or were they there already? And again, we think it's probably a little bit of A and a little bit of B. There are some predisposing factors that we might be born with, and there are changes that occur in the brain as a result of trauma. And Ellie said, yeah, and babies also can't self-report. That's right. That's right. We're at best, we're interpreting their reactions, right? And then we're putting meaning to that. So yeah, if I tickle that baby with a feather and it cries, I interpret that as, oh, that baby's more emotionally sensitive, or that baby's more sensitive to stimuli than a baby that doesn't. But there's also a bunch of other, reasons maybe why that might happen. So we still have a long way to go, but this is sort of like what we think is going on. This research comes from, sort of the last, 20, 30 years, but we need to do a lot more, particularly in the area of understanding invalidation and complex trauma. And again, broadening that definition of actually what children find to be traumatic, which is not always that classic definition of abuse. Okay. So if you would like to reflect on this more, I've got a little suggestion for a little reflection exercise you might want to journal about. So after this session, maybe thinking about how you feel about this biosocial theory of of BPD, that's a typo. And how does that relate to your own life experience? Does this theory feel validating for you? Why or why not, right? As Ellie was saying, does it feel validating to know that this isn't just, these aren't, just like, I'm not putting in enough effort, or there's something, like inherently like, I'm less than other people in some way, but there's actually, like actual differences that make regulating emotions harder for some people. So just a bit of a reflection on what does this mean for you? How do you take in this information? Zoe, I've always been shamed for being sensitive. Yeah. So that's something I hear so much from clients that you're just so sensitive, right? Like that's a bad thing. Emotional sensitivity is it's a double-edged sword, right? Like everything, it's got its pros and its cons. The downside is that if you're an emotionally sensitive person, then you feel painful things much more. That means, and again, this is why most therapists fit into this category, because, we feel things for people, we have that level of empathy, but we also need to learn how to manage that so that we don't burn out, right? And I know that's something that lots of people struggle with that aren't therapists, of like, I really care deeply for other people, but I also can take on too much. So it can be a double-edged sword. So I get hurt really easily if I'm emotionally sensitive, but I connect really well. So if you've ever tried to connect with somebody who's just like super clinical and like just emotionally not keyed in, it's so impossible to do. We connect emotionally. So if you are emotionally sensitive, what that means is that people often will tend to be drawn to you because they feel that. So you might find that you're the person that people share their problems with, or the person that they come to for advice, or the person they come to when they're in crisis. Yeah, I'll give you something to cry about. Exactly, Ellie. Exactly. Yeah. So we really want to change this narrative about emotional sensitivity being a bad thing. Again, we're all on a spectrum somewhere, and there are pros and cons. I think, to go the other extreme, to be somebody who was emotionally shut off, I think would actually be so problematic. And it is, the people that are that way really struggle with relationships. They really struggle to feel connected, and they struggle for meaning because they just don't feel very much. Whereas on the other end of the scale, if you're someone who feels a lot, you can find amazing meaning in things, but it also means you have to work harder to get through those tough times and those tough emotions. Got another little comment here. Yeah, that's right. RODBT, yep, for over controlled personalities. Yes, so RODBT is sort of a newer kind of iteration that's come out. Yes, exactly. And again, we're talking there about invalidation, right? To be, the world saying you're too this, you're too that, you're not enough this, you're not enough that. And really just challenging that and saying, well, actually, your feelings are valid because they're just your feelings. But it is your responsibility to figure out how to regulate them in a way that works for your longer term goals, right? We don't want feelings running the show entirely, but they do need to look in. All right. Any other questions or comments? I will just turn off our recording here.